There's one ingredient that targets post-breakout marks, redness, and uneven skin tone all at the same time, and most people have never heard of it. As a chemist, it's one of my favorites. Azelaic acid is a naturally occurring acid found in grains like wheat, rye, and barley. It works through multiple pathways at once, and that makes it so useful. First, it targets melanin production by inhibiting tyrosinase, the enzyme that starts the pigmentation process. Now, this is worth noting. It does the same job as vitamin C when it comes to brightening, but through a completely different chemical action. Vitamin C works as an antioxidant that reduces compounds along the melanin pathway. Azelaic acid is a direct competitive inhibitor of tyrosinase itself. Same goal, different mechanism. What makes azelaic acid particularly interesting is that it preferentially targets overacting pigment cells, the ones producing too much melanin, while leaving normal skin tone alone. That's why it's especially effective for post-breakout marks. Second, it has antimicrobial properties. It reduces the bacteria associated with acne without promoting the antibiotic resistance that topical antibiotics can cause over time. Third, it's an anti-inflammatory. It's one of the very few actives with solid clinical evidence for calming rosacea. Most actives aggravate rosacea-prone skin. Azelaic acid tends to help it. Effective over-the-counter concentration is 10%. Prescription formulas go up to 15 to 20% for stronger rosacea treatment. On the Yankee list, look for it listed as azelaic acid and check whether the brand discloses the percentage. Because it requires a specific base to stay suspended in the formula, it doesn't always sit in a predictable position on the Yankee, so the percentage disclosure matters more than the position here. Post-breakout marks, redness, and uneven skin tone, one ingredient. That's why it deserves far more attention than it gets.